Hi, I'm Dr. John Young, the doctor here at Foundational Health Center here in Largo, Florida. Today, we're going to talk a little bit about some of my experiences with my own daughter and how this relates to what I'm seeing out there with my own patients. It was a number of years ago that a family brought their daughter to me who was born with a very rare medical condition where even in utero, before the child was ever born, at about 7 months of age, the mother was noticing that the baby was moving like crazy through most of the day, and it turned out that the baby was having seizures in utero, maybe 800 or 900 a day. And the baby was born, and they diagnosed this genetic defect. There was nothing much to do. They put her on medicines for seizures, and basically the child couldn't even go to school because a lot of the seizure medicine just makes them so sleepy you can't even educate them. The child did not have normal milestones in development, was not able to speak. And at 9 years of age, the family brought the daughter to me. And I talked about how we could treat her, and I said, I know how biochemically what's going on with seizures in the brain, but this is a rare disease. I have no ideas. So the parents asked that I treat this child, so I gave this child umbilical cord stem cells through the vertebral vascular system, and that's very important. You have to get those cells directly into the brain as soon as possible. I do it through the vertebral vascular system, which I think makes all the difference in the world. I did it, and the family was a little afraid to stop the seizure medication, so waited a full year, went back and saw the doctor, the neurologist back at the university, and noticed that the child had no seizures, did an EEG. And remember, seizure medication just makes it so you don't see the seizures. Seizures are still going on in the brain. We as mom and dad don't see it, and we're happy. And he says she has no seizures. So they stopped the seizure medication, and she's been fine. That was 3 years ago. I saw her recently, and no seizure meds. And then the next part of our conversation, I think, was so interesting because we're at a dinner table talking. They said we would talk to our daughter, even though she's much older now, and we talked to her as a little kid because she can't really speak, and so communication was really very difficult. So they told me about a movie out there on Netflix or YouTube, one of those, called Spellers, Spellers. And it's a story about a woman whose child, I think, was autistic and could not speak, and used a board, and the child was able to pick out HOWAREYOU, could spell how are you, could spell what information he wanted to get out there. And the child really had not had much schooling. And the lady found out that her son was very intelligent. So they got her child, this girl, involved in the Spellers. And you can look it up. I think there's a branch here, or the woman that actually started it is in Tampa. And they got involved in the courses and started working with their daughter. So the parents asked her, how are you feeling? Is there anything that we do that upsets you? And she spelled it out. I hate it when you talk to me like I'm a child. I am not a child. I'm a teenager. You don't have to treat me like a child. Completely blew them away. And it is so amazing that we, I think, are treating a lot of these people that can't communicate well as complete imbeciles. And then they had other examples of children talking about their condition, talking as if the English is impeccable, and the words they use are just very highbrow words, communicating with their parents or friends or whatever. And recently, my wife told me about her daughter who has Down syndrome, and she does speak, and she's done very, very well. But she's in high school now, and she's helping at the special needs kids run the little coffee bar for the first 2 periods of class at the high school. And some clean tables if they aren't high functioning. Others will, bring the product that they ordered, coffee or a bun or something, and then collect money and give them change. And so Catherine was just cleaning the table. And yesterday, the girl that, takes the food to them and gets their money, she wasn't there. So the teacher had Catherine to fill in and kind of watched over her. And Catherine took it to them. The person that bought it gave Catherine the money, and Catherine gave her the correct change, 50 cents. Way beyond anything we thought she even knew how to do. Just saying that these kids know more than we think. And, check out Spellers. But I think all the things that we've done for Catherine, stem cells, increasing BDNF levels, pyridine, we may think that they're not working. They are.